with you. If Dr. Murray omitted information about propofol, which it seems like he did, wouldn't he have thought to himself, when we get to autopsy, they're going to find out what I gave him?
Of
True?
I think that is true. I mean, anytime you care for a patient, delivering any care, it's important that I know of a history, I do a physical, and I know what the patient's taking, because that means vital information to me, especially when you pass off that care to another provider, such as an ER physician.
And as I said earlier, Dr. Dombrowski, it's just a standard of care. When somebody hands off, you tell them everything you know, you give them the list of medications. We've all done that thousands of times. It seems, it's negligent not to do that, is it not?
Well,
True?
I mean, I can't speak to all the, facts of the case, but in general, as you're talking about just physician to physician, we've handed off cases a lot of times. Anesthesiologists do this all the time, whether going to the PACU, the post-anesthesia care unit, picking up a patient. We tell what we've given the patient, and then we pass that care off to the nurse, and the care's from there, from that point on out.
Ryan, to you, true or false? Dr. Murray was on the phone with his former girlfriend when he realized Michael Jackson was in dire shape. Is that true?
Oh, that's true. I want to give you a slight caveat. I know I want to give you a straight answer, but I'll tell you what I know. At 12:30 or so, she says, this is Sade Anding, she says that she was on the phone with Conrad Murray. They were having a talk. All of a sudden, she hears a loud noise in the background, then coughing. Then Murray immediately drops off the phone. Now, you put that in the time frame. Paramedics calling the time of death at 12:57. There was time between when they were called. It just sounds like he was on the phone with this woman at the time of death. But her testimony is coming up, so we'll learn more about actually when they were on the phone.
Wow, that one sounds bad. Ryan, true or false? Dr. Murray tried to collect vials from Jackson's nightstand before he called 911. Again, consciousness of guilt. True or false?
That's absolutely true, and that's because Alberto Alvarez was in the bedroom with him and said that he was being directed by Conrad Murray to collect things all over the ground, and this was before 911 was even called. Now, the defense has said that Dr. Murray thought 911 was already being called, but your question is the real point here, and in that case, that's what he was doing. He was gathering up those vials, and that's uncontroverted at this point. Everybody, that's clear in the testimony.
And I'm hoping by playing this little game, we're sort of clarifying a pretty complex situation for people. So I'm going to go to Dr. Dombrowski now. It's his turn. 2 doses of Ativan, 2 milligrams each, a dose of midazolam along with 25 milligrams of propofol is more than sufficient to cause Michael Jackson to stop breathing.
Again, I can't really speak to that number because, again, it's just a number. And we understand that Mr. Jackson's had exposure to previous medications, a lot of them. And he required a lot of medications to get to a level of sedation because he built up tolerance. This is fairly true. But obviously, if you put in benzodiazepines with propofol, yes, you will have an apneic, not breathing patient. That's the role of the physician to intervene and correct that.
Dr. Dombrowski, I'm going to step outside my game for just a quick second and just get your opinion on this idea that Michael Jackson drank the propofol. Is there any merit to that idea that he ingested it through his gastrointestinal tract?
I've never heard of that, and if that were the case, it wouldn't work that way. I mean, it can only work when it's given intravenously. It does not work through the GI system. I've never even heard of it that way.
Well, me either. I've been wanting to ask somebody that of your sort of training, and to me, much was made of that at one time, and that seems like he might as well have drank milk. Because I don't see that functioning really at all, unless some toxicologist out there can tell me otherwise.
Again, in the practice that we have, that's never the way to administer that medication. It's only effective intravenously. I can't speak to it, but I've never heard of that even having any effect.
Finally, another true or false for Dr. Dombrowski. Propofol is not a drug that is used outside of a hospital setting. We saw the defense arguing with the cardiologist or sort of trying to poke holes in that idea. When I heard that that propofol was used, A, for sleep, and B, outside of a hospital, you might as well have told me an asteroid hit Wisconsin.
Right. I mean, to their point, I mean, outside the hospital. Now, what is that definition of a hospital? An ambulatory surgical center, perhaps a physician's office for sedation for cosmetic surgery or dental procedures, things like that. But there will be an attendance of an anesthesiologist in the care of that patient. And to your point, there's never ever a case where it's done in a home setting for to assist sleep.